Welcome back to our channel. Buckle up for a great learning adventure. The vagus nerve. Cranial nerve 10. The vagus nerve is a mixed nerve. This means that in its structure, it houses both afferent or sensory and efferent or motor fibers. Specifically, the vagus nerve contains the following fibers. General sensory fibers. These carry sensations like touch, pain, temperature, pressure, vibration, and even your sense of body position. Special sensory fibers bring in the sensations of taste from your palate and epiglottis, and they're also responsible for hearing and balance. Visceral sensory fibers are in charge of sensory input, except for pain, from the visceral organs like the heart, lungs, and digestive organs. Branchial efferent or motor fibers are the messengers to the muscles that develop from the branchial arches. These include the muscles of mastication, as well as the tensor veli palatini. Time for some fun facts. Did you know we have hundreds of such videos, mind maps, and notes? Go on, download our app and get access now. Let's discuss the branches of the vagus nerve. Branches within the jugular fossa are the Meningeal Branch and the Auricular Branch. Branches within the neck, Pharyngeal branches, superior laryngeal nerve, recurrent laryngeal nerve, and the superior cardiac branches. Let us learn a little bit about each of these branches. First up, we have the Meningeal branch, which arises at the superior ganglion. As its name suggests, it travels back into the skull through the same jugular foramen and provides a sensory supply to the dura mater. Next, we have the Auricular branch, sometimes referred to as Arnold's nerve. Just like the Meningeal branch, it begins at the superior ganglion and re-enters the jugular foramen, only to exit again through the tympanomastoid suture of the temporal bone. It is responsible for providing sensation to the external tympanic membrane or the eardrum. Now let's shift our focus to the branches of the vagus nerve in the neck. First up are the pharyngeal branches that emerge from the inferior ganglion of the vagus nerve. Now, these branches are quite special because they contain two types of fibers, visceral afferent and motor fibers, which means they provide sensations to the neck and throat, as well as contribute to their motor functions. These nerves form a plexus with branches of the glossopharyngeal nerve and the superior cervical ganglion. Next, we have the superior laryngeal nerve, which arises from the inferior ganglion of the vagus nerve. As it reaches the tip of the hyoid bone, the superior laryngeal nerve splits into two branches, the internal and external laryngeal nerves. The internal laryngeal branch enters the larynx by piercing the thyrohyoid membrane and takes on the role of supplying most of the mucosa located above the glottis. The external laryngeal branch travels towards the inferior pharyngeal constrictor muscle to innervate a specific intrinsic laryngeal muscle called the cricothyroid muscle. The next nerve arising from the vagus nerve within the neck is the recurrent laryngeal nerves, sometimes referred to as the inferior laryngeal nerves. These nerves earned their name, recurrent laryngeal nerves, because they travel in the opposite direction of their origin. The right recurrent laryngeal nerve branches from the vagus nerve at the base of the neck,
travels below the subclavian artery, and then moves upward along the tracheoesophageal groove to enter the larynx. The left recurrent laryngeal is sometimes categorized under the branches arising within the thorax. It has a similar route as the right, but with a twist. It leaves the neck to enter the thorax, loops around the aortic arch, and ascends back into the neck to supply the larynx. The recurrent laryngeal nerves supply all the intrinsic muscles of the larynx except for the cricothyroid muscle.
For a more interactive way to learn, check out our app and website. It's packed with notes, mind maps, and everything you need to ace your exams.